One of our advancing technologies is driven by the wish to have a healthy baby and one at a time. And this is really the big thing we're trying to overcome, is put only one embryo back and have a healthy baby. Now, we know that men and women, as they move further in the reproductive ages, the quality of their sperm and egg go down. So with those conditions, we tend to put more than one embryo back, or let a woman release more than one egg at a time, hoping to get one winner. But we also want a healthy baby. Technologies are now improving to be able to actually test an embryo before we put it in, to know whether or not it has the right number and distribution of chromosomes. We all know about things like amniocentesis, testing once a woman's pregnant and getting amniotic fluid at about 14 weeks into a pregnancy, or even something called chorionic villi sampling, termed CVS, at about 11 weeks. But now we can basically do that CVS, take a few placental cells of an embryo before we put it in and get an answer. And then know, is this embryo worthy to put in? How do I avoid a miscarriage? The delay to try again? How can we have our best assurance that we're going to have a healthy baby? So people can go through in vitro fertilization, and if they need to, or if there's genetic issues, other issues at hand, or recurrent miscarriages, and we can screen embryos before we put them in, and only put an embryo in that has a very good chance of succeeding. The other reason we do genetic screening is if a couple has a problem genetically, then we can test an embryo before we put it back and only choose an embryo that would not be affected. And that is an amazing change in technology. This is for all sorts of genetic issues, but it's called Pre-implantation Genetic Diagnosis, or PGD. And if we're just screening the number of chromosomes, that's more of a screening test. We call that Preimplantation Genetic Screening, or PGS. And this is a major boon in technology to effectively help people have babies that are more likely to be healthy. It also gives us more confidence that we don't have to put more in seeing what's going to stick. We can exclude probably 70% of the reasons why an embryo would not work to be a baby. And if we only pick the one that has the ability to succeed, then we reduce that multiple birth risk, the preterm delivery risks, and the complications to babies. And we also can reduce the miscarriages. This is emerging technology, and we'll be refining it over the next several years, but this is wonderful news for folks.